Alaska Health Department Accreditation Plan by Tony Brantley, Vicki Eber, and Sarah Kloster. Alaska has a population with a median age of 33.8 years. It is primarily white, with American Indian and Alaska Natives, and a smaller population of Asians and African Americans. The unemployment rate is currently at 6.3%, which has dropped from recent years. The majority of the jobs Alaskans have are in the physical labor field, such as construction, labor, and commercial fishing. A large portion of the population may not financially be able to afford amenities and proper healthcare options due to the annual salary. The state of Alaska has a strong behavioral and public health focus, with accessible locations throughout the state, offering the various programs essential to the betterment of the health of large communities as well as their smaller villages. The behavioral health program also focuses in on substance abuse and addiction, which is prevalent in the state of Alaska, encouraging residents to take responsibility for their health and choices that lead their actions. The Alaska Psychiatric Institute received accreditation for psychiatric care, despite there being an investigation into the safety of employees and patients. Due to this accreditation, they were able to receive full state licensure, nearly doubled patient intake, and increased staffing and decreased wait times. As mentioned before, the main areas of focus for the state of Alaska are around mental and behavioral health, as well as public health concerns. The Department of Public Health offers services for residents of all communities statewide. The Behavioral Health Division focuses on mental health and substance use, as these are often comorbid. Heavy alcohol consumption has been on a steady incline since 2008 in the state of Alaska. Though the opioid rate is 10% lower than the U.S. rate, there has been an increase, which the department is currently monitoring. Alaska's suicide rate was close to double the national average in 2015. The rate has steadily increased from 2008 to 2017. Public health focuses of safety and livelihood tie into the previously mentioned substance abuse and mental health priorities, as well as the rate of unemployment and cost of living for housing. The mission and vision of the Alaska Department of Health and Social Services are to protect and promote the health of Alaskans so they can enjoy optimum health and safety through achieving greater community, public, and personal responsibility for healthy conditions and choices. By working with the Behavioral Health Department, the Department of Health and Social Services will be able to support these communities in identifying problem areas such as mental health and suicide rates, substance abuse concerns, and the livelihood of Alaskans. The solutions, such as prevention efforts and encouraging safe and accessible home environments that can help with positive health outcomes. Measures for the state of Alaska is in comparison to the U.S. percentage rate difference, based on the year-to-year improvements or detriments in each category. With this in consideration, the measures for improvement to be considered satisfactory are the following. The balanced scorecard has 4 perspectives. Financial focus on 3 key priorities: mental, behavioral, and public health concerns for the state. Adjust for more affordable housing to help offset the rate of homelessness. Improve job trainings and offerings will increase employment rates. And improving community equity means less missed work due to improved health. This can also reduce the risk of unemployment due to primary illnesses. Second, customer focus to improve upon the 3 key priorities above to improve health of the community. This can improve personal and community value, which helps to empower the community to take responsibility for their health and choices. Improving community connection would be to improve access and knowledge to resources made available, which helps to improve overall health for all demographics in Alaska. And improving care experiences for the community gives a level of trust to healthcare providers and empowerment to community to learn responsible choices to take charge of their health. The third, internal processes, improved dissemination efforts for marketing to children's health and safety could lead to decreased or improvement in domestic abuse situations and later adult onset mental conditions. Increasing medical partnerships, such as hospital and health organization collaboration, will increase amount of offerings and coverage of care. Potential for health insurance expansion to cover priority areas of health, and then community members would be more adept to take responsibility for their health, and the community health would improve. The fourth, organizational capacity, working family support, or FMLA, can assist for those parents who are out of work due to mental illness, allowing them time to recover and return to work, reducing the risk of unemployment. First responder readiness and education can decrease mortality rate for alcohol and opioid-induced deaths due to overdose. And finally, trauma readiness trainings assist in quick response to suicide attempts, decreasing the overall rate of suicide and accidental deaths. The CDC offers incentives such as the Strong System, Stronger Communities, which provide support to health departments in completing projects to improve their performance and meet national accreditation standards. They promote interconnection across the public health system to improve population health. The CDC also offers grant opportunities. This is in cooperative agreement and grant funding to support accreditation. The CDC supports Public Health Accreditation Board by playing a vital role in these explorations, by leading the efforts, providing subject matter expertise, or supporting the PHAB in its work to explore these topics. The CDC offers different resources through partnerships with the American Public Health Association, the National Association of County and City Health Officials, and the Network of Public Health Institutes. The benefits of accreditation are many, but some include identifying the strengths and weaknesses of the department, promoting transparency throughout the department, delivering on 10 public health services, and improving communication. Prevention strategies are necessary to monitor health status, investigate health problems, inform, educate, and empower the people of Alaska about their health issues, mobilize community partnerships, and develop policies to support the community and individuals. More strategies are to enforce laws, encourage the link people may need for personal health services, assure a competent public health workforce, evaluate the effectiveness and accessibility of the health services, and research new innovative solutions to health problems. As referenced above, our appendices include the background information of the population, unemployment rates, the Alaska wages, the different types of jobs held by workers, suicide rates, and our balanced scorecard. Our references, thank you for taking time to watch our video.